All right, the time is now 6:01, so I think it's a good time to start. So hi everyone and welcome to CCI Health Services Prenatal Care Info Session. My name is Oyenade Koe and I am the Creative Services Manager at CCI. This is our second session of 3. Our last session will be held on September 10th at 6 p.m. More info about these sessions and to register can be found on our website at cciweb.org. During this session, we will provide a brief overview of CCI Health Services and all of the care we provide before talking more about our prenatal and WIC programs. We encourage you to use the chat function on StreamYard for all of your questions, and we will answer them either during the presentation or at the end. So let's get started. Who is CCI Health Services? CCI is a federally qualified health center with a mission to deliver high-quality, accessible care to our community members. We provide our care to everyone, regardless of insurance status or citizenship. Our services include everything from medical, dental, and behavioral health care to support programs for our patients. So what does this look like? Well, for primary care, this includes your annual checkups, vaccinations, and lab work. For your preventative dental care, we provide routine dental x-rays and cleanings, and our specialty programs such as CenteringPregnancy and WIC for growing families, which you'll hear more about tonight. So now you know who we are and what we provide, but now I want to show you this map of our locations so you can see where we provide these services. We have health centers across Montgomery and Prince George's County, and we'll soon open our own pharmacy in Gaithersburg and Greenbelt. While we do have locations all over, our prenatal care services are only offered at our Greenbelt and Silver Spring locations. However, this doesn't mean that we only serve people in these areas. Our patients come from all over, and we're happy to welcome them through the doors. It's important for me to acknowledge that CCI is committed to ensuring that everyone receives the care they deserve. We want you to know that here at CCI, when it comes to your health, you do have options. So whether you or someone you know chooses not to continue their pregnancy or become a parent, we can provide information and counseling on abortion and adoption services. Now I'll pass it on to Sherlyn, our maternal and child health coordinator, who will talk more about prenatal care at CCI.
Hi everybody, good evening. As they say, I am Sherlyn, the maternal and child health program coordinator at CCI, and I am one of the coordinators that works with Centering Pregnancy, which is our model of care that helps our moms a lot during their whole process, even after they have the baby. Centering Pregnancy was created by Centering Health Institute. This program brings together a small group of expectant parents in the same pregnancy stage with a health provider in a series of engaging and supportive sessions. Each session provides an opportunity for participants to have their questions answered, talk with others of the same journey to parenthood, and spend more time with their health provider and care team. Centering Pregnancy has been so successful at CCI for that reason. It provides reassurance, a sense of confidence that your prenatal journey will not be perfect, but you will always have a place that will help you better understand your pregnancy, but also be excited along the way. With CCI and our model of care, having that extra time with your provider allows you to ask all the questions or concerns that you may have. The ability to tell your provider that what you want and what are you looking for your prenatal care without feeling neglected or rushed. Your prenatal care is all about you and your baby, and Centering Pregnancy helps make sure that your prenatal process is healthy and safe, all things that you really need, and that you're happy about it. We offer a lot of help and resources. We try to help our moms in providing the necessary items that a baby would need. There's a list of incentives that we provide in our group sessions that if we have them available, we help our moms provide them, from baby carriers to nursing pillows, birthing balls to strollers, etc. We also do baby showers within the moms and reunions as a postpartum get-together to meet all the babies. We have a diverse of providers that are willing to help you in every step of the way for your prenatal care. They're all willing to answer your questions. They are willing to put themselves in your situation and help you better understand what your prenatal care is, what pregnancy is, and to make you feel safe, but also calm and less nervous. Next slide, please. But yes, Centering Pregnancy at CCI is very successful, and we really wish to help as many moms as we want and as we can. And that's why we are excited to promote it throughout the whole state of Maryland, because it's very successful and we've seen a high rate of success rates. Next slide. Here's a few pictures of our reunions. So we typically have around 10 moms in each session, and in every reunion we get to see a bond that they create during the pregnancy and after with the babies. They get to meet every single one, and the providers just feel happy with everything that the centering has done and the outcomes that it's become. We've also have belly castings, which is a new part of a new activity that we've involved in centering, which is a little reward that the moms have started to feel, because they can keep a little memory of their prenatal care. A lot of moms use this as a way for, if this is their last pregnancy and they're not expecting to want anymore, they take the belly castings as a way to have a memory of their last pregnancy. And now to our wonderful WIC director, Jose Luis.
Good afternoon, good evening, everyone. Thank you very much for being here with us. And I'm going to talk to you a little bit about WIC. And just like centering is all about you and your family, WIC is really an education program that will give you the information that you need to make decisions about nutrition, what your family eats on a daily basis, that allows you to have a healthy beginning. And our program is really focused on giving you the information, the education, and the tools so you can make decisions around what is going to be eating your families. And one of the things that we're going to make sure happens is that we combine not only your culture, your traditions, but also what's happening around your body. We're going to measure a few things that are going to give us some clues of what's needed in the whole education process. And so in essence, what we want to do is not only give you information, but also give you some additional funds, some monies. We're going to give you a debit card that is going to allow you to buy nutritious food at the supermarkets. And these foods are going to be basically fruits, vegetables, milk, eggs, bread, legumes, beans, supplemental. This is going to supplement what you typically eat. They're going to be nutritious, and they're going to be very specific about you and your family. And one of the things that we really want to make sure is that we get to know you. We're going to have an opportunity to be with you through your pregnancy, and then your baby will be part of the program as well until they turn the age of 5. If everything is going great, we only need to see you at least every 6 months. We want to chart your growth, your baby's growth, and we want to make sure that all of the different milestones that need to be hit are happening. And to make sure that that's the case, we will give you this debit card. We will load money into the debit card every 30 days. And then the only thing that we ask in return is that you take some classes. These classes are going to be taken online, on your phone. And the same thing is, the same idea is that we are going to be building knowledge for you to make decisions about what happens in your day-to-day life in your family. Our WIC locations are throughout Montgomery County and parts of Prince George's County. We have 4 main sites: Gaithersburg, Greenway, which is Greenbelt, Tacoma Park, and Wheaton. And I should mention that the WIC program that we have at CCI is the largest in the state of Maryland, and we serve about 32,000 people annually. Some of these sites are conveniently located with our medical sites, which allows you to have an opportunity to combine appointments, so you can have your WIC appointment and then have your either pediatric appointment or your centering appointment around the same time. We will also be part of the centering sessions at one point during the whole length of the program. But what's really important for you to understand about WIC is that the idea is for you to really have the tools, the knowledge, and the decision making to make sure that your family, your kids have the best beginning that they can have based on nutrition. In order to be part of WIC, there's very few things that are required. You either need to be pregnant, breastfeeding, or have a child under the age of 5. And live in either county, Montgomery County or Prince George's County. Is pretty straightforward. Our services also provide support around breastfeeding. We believe that breastfeeding really lays the foundation for a very healthy beginning for both the person that is pregnant and the baby. And so we'll spend a lot of time talking to you about breastfeeding and what are the things that you need to put in place to make your breastfeeding experience a positive one. And so we'll have breastfeeding peer counselors available to help you sort of guide you through that journey, because it really is not as straightforward as we think it might be. So the added support is really important. So we'll have the nutrition education, breastfeeding support, and the last thing that will add to our relationship is connection to other resources. We will refer you to other resources that we think might be useful for your family to have, and they could be anything. It could be medical resources, it could be transportation, housing, or any other things that we think might be useful for your family to be to avail themselves to. Together, we can be working towards having an understanding of what nutrition can do for your health for the next 5 or 6 years. So let's embark in that your journey as you are getting ready to bring this baby into this world. We'll be happy to answer any questions that you may have.
So please use the chat function to ask questions. We have everyone here available to you, so please feel free to ask anything in regards to our program requirements or just how do you set up an appointment. Just let us know. If you're tuned in from your computer, the chat function should be just below the video, as well as on your phone. We have one question. I'm going to bring it up for this on the screen. Angela asks, what MCOs do you accept for clients who want to start prenatal care?
Usually the MCOs that we do take is WellPoint, United Healthcare, Priority Partners, Care First, Blue Cross Blue Shield. We don't take Kaiser for the fact that they do have their own clinic, MedStar and Aetna as well. We've seen a lot of complications with the labor and induction that it usually doesn't cover with the hospitals that we're connected to.
Thank you, Angela. Another question just came in. Shayna, I hope I pronounced that correctly. You said something about housing. How does that assistance work?
Well, typically when it comes to other services not housed within CCI, what we provide is the referral information. Basically, who do you contact to find out what's available in your county for those services? So that We have a list of other community-based organizations that focus on specific areas, and housing is one of those. So what we would typically do is provide you with a referral, which consists of the contact information, phone number, or email for that specific program.
Thank you. Another question just came in. This is from Catherine. She asked, is maternal mental health available postpartum?
Yes, it usually is available postpartum. You would just need a referral from your provider to see our behavioral health providers in clinic.
And I would add that our behavioral health program is integrated in the delivery of primary care. So it is understood that part of our well-being is not just the physical, but also the mental. So anybody who is a patient of ours in our medical setup also it has the behavioral health available to them. So it is all integrated into the delivery of care.
Thank you. We have another question. This is from Shayna again. How do we get more information?
So Shayna, just send us an email. You have the email on the screen. And when you email us, we can email you back with specific information related to your query.
You can also call the number that is on the screen as well. The appointments line is there, and then also the WIC direct line is there as well. Another question just came through. Angela asks, when will prenatal care be available at the Silver Spring location?
That has actually already started. So you can call at the number up top, or I can also provide. Is there a way we can provide my number in there, Yanade? We have actually started the prenatal care at Silver Spring. We just have to go through an intake process first, where you're evaluated with our registered nurse and seen by a provider as well, and we get started from there. But you do have to go through an intake appointment first before starting any prenatal care.
And I can email everyone after this meeting and give you Charlene and JL's direct contact information if you need it. Next question. This is from Catherine. She asks, is transportation provided to Greenbelt patients since the new move?
Yes, for now we still are providing Uber to the patients to go into their appointments and back to their house. I do know it's just specifically from their house to their prenatal or any appointment that they have. It's nowhere else, but there is Uber transportation provided as of now.
Thank you. Anyone else have questions? Please feel free to use the chat. In regards to Catherine's question about transportation, the new move, in case you didn't know, CCI Health Services will be opening a brand new health center in Greenbelt called Orgland, and it will be on Orgland Drive, very much near our Greenway location. And this new location will house literally all of our services, from medical, prenatal, pharmacy, to our pediatric and graduate medical education as well. Let's see. Another question from Catherine. She says, how long will this be active for? I'm thinking that she's referring to the transportation.
I believe is by the end of September. If not, we can also help you. I know most MCOs do provide transportation services. We can also help you with contacting them once our services have ended with the transportation.
That is correct. All MCOs have to provide transportation to folks as part of the rules under the Affordable Care Act laws.
Next question from Angela. She asks, is there a limit to the number of weeks of pregnancy that you will accept as a new patient? And can you please provide the intake number for clients who want to start PNC?
So the cutoff date that we have is 28 weeks of your new OB appointment. So by your new OB appointment, you do have to be 28 weeks or less. If we do see that you will pass that time by the new appointment date, we do provide OB resources, and we also help you see other clinics that are available or that will be able to take you sooner. With the intake right now, they're in Silver Spring, I believe it's 25 a month of intake patients that we are taking. So it's basically first come, first serve for the month, depending on the amount of availability that we have. Since we just started with Silver Spring, we're starting off pretty small and then going up afterwards. But yes, it's very limited right now, but we are taking. So if we do have availability, we will schedule with the provider and the nurse.
Next question is, do you guys offer doula services? Great question.
Yes, we do. So during centering, during session 5 and 6, our doulas do come in and they have an info session with us, and they do the exercises, the common discomforts during labor. We do the belly casting, and they do also do the postpartum session. So they give a brief info session regarding postpartum, and they also offer services outside centering. So if your insurance does cover it, they would also help you with postpartum care. But we do have new integrated doulas during centering. So they usually come in first session and then also 5 and 6.
Thank you. Looks like we just have some thank yous in the chat. Catherine said, thank you for your information and time. It's great to see CCI expanding. Hope to continue to see accessibility for patients and, more important, needed services provided. Congrats. Thank you for that wonderful message. Again, please use the chat function to ask your questions, and I will be sure to email everyone our contact information so that you have it. Additionally, if you do want to learn more about our prenatal care program, we do have a lovely video on our website. So if you go to our website and you click on services and then you go to prenatal care, there is a video there where you can learn more and see some patient reviews as well. It does look like the chat function has slowed down. So I want to thank everyone for tuning in. Again, we have one more session on September 10th. So feel free to invite your colleagues, your friends, or anyone you know who is interested in our services. And yeah, thank you for attending. Someone else had another comment. Thank you for the great presentation. Silver Spring Health Center Maternity Home Visiting Program will be referring our clients to your clinic. We are very excited. Thank you so much. Please feel free to email me as well when you get our information so that we can connect. We love connecting with our partners. So thank you for tuning in, and I hope everyone has a great evening.
Bye.